So hello and welcome, and hi Robert, and thank you for joining me here at BusyHive podcast.
No worries. Thank you very much for inviting me.
So here at BusyHive, we really like to start every show with our guest favorite quote. It's kind of our way to get everybody motivated and excited for the rest of the show. So Robert, can you tell us what's your favorite quote and why?
So yeah, I've thought long and hard. This is a hard question for me. There's lots of quotes that I really like. And I think the one which is most useful to me is something I ask myself a lot, and it's why is it done that way, and can it be done better? And it's something which we use an awful lot in the clinic. It's kind of how I run my business. We've had it up on the walls of staff rooms. I've had it up on the wall in the office, and then we apply it to every process. Really question why something is done. Can it be improved? Can it be made easier? And this might be from how we advertise, our new patient intake process, or just normal patient management.
That's a really, really great thing, because we can exactly always make things better. So even if you in practice or you're doing things for a while, it's always to do like even twice a year or once a month to kind of spend a little bit of the time to actually look at the things. What you do, how you do, to make them better, more efficient, more beneficial for your business, for your clients, and so on, just to kind of have this better structure of things and make it much easier for everyone.
Streamline lots of processes really is what it helped us, and saved us a lot of time, saved patients time, which is what you want when you run a clinic, really. Yeah,
exactly. And in this busy life, busy time. Well, people even expect this to be everything efficient and happens now and then. So, if we running our clinic or our appointments and strategies in there, which makes everything efficient, makes our work and their experience much better.
Very much so.
So can you share one of the challenges as a new therapist when you started?
I think the biggest challenge which we had, or which I had when I first started, and I know a lot of other people had similar experiences, was probably discussing prognoses with patients. So once patients come to see you and you've diagnosed them and said you have a strained muscle or a slipped disc, knowing how long it's going to take to get better. And patients always obviously want to know that. Is this going to be better by next week or by next month or in a year's time? And that's something which only really comes with experience. Yes, you have a rough idea once you've graduated, how long things are going to take, and you've seen a few patients in the student clinics, but something that really comes with time and assessing patterns with patients. And yes, although two patients might have a slipped disc, you know that one is going to take a lot longer because they commute for a living or something, and picking up those differences between patients was difficult, and something which does take experience and a lot of time to really get good at.
Because that's a really important thing for retention and rebooking clients. I actually show them this expectancy, because they come in and they just want to get fixed.
Yes, yeah, exactly.
But we know not always things happen straight away. So how to tell them?
Exactly, yeah. And I think that's something which only comes with experience. And I spoke to a lot of people, observed other clinicians, spoke to my bosses about it, other people going through the same the same experience I was. And I think the only thing that helped most was going back through notes and looking at, why did this patient take 6 weeks to get better and this other patient took 1 week to get better? What were the differences, and highlighting them really.
Exactly. And this is coming back again, reviewing things,
exactly.
What's happened, what we've done, what we can make better. Yeah. And practice. Even, myself as a therapist, when I starting up, it's really hard for us therapists to, don't sound salesy, to don't tell them clients to come to us so they feel better, which is always silly, because that's the point. We're sharing our passion and they coming to see you to feel better. So why not just kind of get them to experience this more often for their benefits?
And I think you always,
go on.
You always want patients to almost like you and be friends with you. So when someone says, I really want to play a rugby match on Saturday, or I've got to go on holiday tomorrow, it's very hard not to say, yes, you're going to be better by then, or I'm going to do, you can do everything you can to get them, but obviously in some cases they're not going to be better, or they're not going to be ready to play that rugby match. And I think, it's hard to break that bad news, really. And it's, again, something that only comes with practice and with time.
And experience.
Experience.
Thank you for sharing that. So here at BusyHive, we really focus on the beginning of our journey, because we really can find out and experience a lot of things from it. So can you tell us, how did you get started, and how did you get to the point where are you today?
So I, as in since I graduated or before I graduated?
So how did you, how did you start? How did you get started to become a chiropractor? What's that started?
So I knew I wanted to do something within the healthcare field. I looked at physiotherapy, osteopathy, chiropractic. My original goal was to be the Bath rugby physiotherapist. I was in Bath at the time, and I thought that would be a pretty cool job.
You're a rugby boy.
Yes, I grew up playing rugby. That was always my sport. That was my original goal. And I had a good friend of mine who had already applied to be a chiropractor, to study chiropractic. And she said, "Oh, you want to go and see my chiropractor? He's fantastic." So I called him and booked in to observe for a day. And coincidentally, he happened to be treating two members of the Bath rugby team on that day. And I thought, oh, this is quite cool. And I really liked what he did. He was a chiropractor in Bath. And I applied the following week, and then I finished my A-levels. I applied to the Anglo-European College of Chiropractic, which is in Bournemouth. I applied there, passed my A-levels, got accepted, and never really looked back from there, really. Once I graduated, I applied for a job over in Essex. So I worked over in Essex for 2 years. I was lucky enough to work in a clinic, a big multidisciplinary clinic, which had massage therapists and dentists and chiropractors. But it had an NHS contract, so I was lucky enough to work in the NHS system for a couple of years. So I saw patients which you would have never seen in private practice, a very different patient base. So I learned a lot. And then from there, I decided I wanted to do my own thing, really. So together with my wife, who wasn't my wife at the time, we moved over to Cirencester, to the West Country, where I was from originally, and set up our practice in Cirencester. It started out as just myself and my wife. One of us would see patients while the other person would manage reception and manage the phones, and then we'd switch every couple of hours or switch in the afternoon. We kind of grew from there. So that was in 2013 or 14 we set up, sorry. And then 4 years later, we've gone from strength to strength, really.
Brilliant. So have you had any treatment before that? Have you experienced chiropractic treatment before deciding? Or when you were in the rugby team or playing, have you experienced a therapy like that?
The only therapy I'd experienced was an osteopath previously. We had an osteopath who was one of the students' parents who used to treat our rugby team at school. And we had a couple of treatments from them. And he was the one who actually said, or one of the people who said, who got me interested in doing something healthcare related, because it meant I could work with athletes and work with sports people. And then he didn't specifically say you need to be an osteopath or you need to be a chiropractor. He just said, investigate them all and see what you're interested in, really. And I think it was just that's just the one I chose, really.
Brilliant. So thank you really for sharing that. So let's move on to the next part, which is my favorite part of the show, exactly, because we're going to choose the topic which is really related to the to our guests. So we're going to talk about the chiropractic. So what is a chiropractic? What's that? Can you explain that?
Oh yeah, I can try. It's a hard question. So chiropractic is a healthcare profession and not a treatment, and I think it's something which a lot of people get confused about. So it's grown and evolved a lot, obviously since its inception, 150 years ago. And nowadays, evidence-based chiropractors are specialists in the treatment and prevention of musculoskeletal injuries. So as I explain to my patients, we treat issues arising from joints, muscles, and nerves, really. And then chiropractors will lean on many different techniques as part of a treatment to help their patient. This might include joint manipulation, which a lot of chiropractors will call adjustments or adjusting, joint mobilization, back cracking, yes, yeah, and then muscle work, sports massage, exercises, and rehab, whatever you can do really to help the person sat in front of you.
Okay, thank you. So, is the biggest question, because lots of people are interested and lots of people are always asking. So how different is chiropractic from osteopathy?
From osteopathy, yes, yeah. So again, another difficult question, and you ask any chiropractor or any osteopath, and you'll
Battle for the years.
but osteopathy is yes, and it's we'll all have been asked it every single day or every single week since we started in practice, and I don't think anyone has quite found the perfect answer yet. And there's also a lot of interprofessional kind of bashing as well. I'm sure you've seen on social media.
Yes.
Go and see this person, don't see this person, whatever, and vice versa. But the way I explain it to my patients when they ask me, is that truthfully all the lines between chiro and osteo and physiotherapy have blurred kind of more and more over the years as we've moved forward with evidence-based practice. And I would say the difference is now mainly down purely to the individual practitioner, not the profession. I'm personally a chiropractor, and obviously, but I've worked alongside some fantastic osteopaths, and I have some fantastic physiotherapists at my practice who treat in a very similar fashion to how I do. But I've also worked alongside some chiropractors who treat slightly differently to how I do. And I would say look out for, generally the good clinicians, whatever therapy they may be from, are the people who really focus on helping you to get better as fast as possible. And encouraging you to self-manage or to do as much as you can for yourself as well, be it with exercises or lifestyle changes, lifestyle advice, rather than promoting reliance on themselves or their therapy to fix you, if you will. I know there are a few differences in training. The main difference between chiropractic and osteopathy when it comes to training is that chiropractors learn to take and read x-rays and MRI scans. So I know a lot of chiropractors, or some chiropractors, will own x-ray equipment and will take x-rays in their practice. And there's a lot more channels to physiotherapy post-graduation. Obviously, they can go into prosthetics or stroke rehab or respiratory physiotherapy, and musculoskeletal therapy just being one branch of it. And there are a few subspecialties in chiropractic and osteopathy, cranial osteopathy or chiropractic neurology, but they are slightly less well developed than, say, the physiotherapy channels. But I think at the end of the day, I can testify to what I do, which is I inform my patients that their bodies are pretty strong and stable. I personally don't use a lot of imaging, although there are times when it's very, very necessary. But I utilize lots of different forms of treatment and adapt depending on the patient in front of you. So all of my patients will leave me with exercises or rehab. And this will vary patient to patient. So it could be simple as just going for a walk or sitting and standing from a chair, or much more sport specific and complex depending on what their issue is, really. So it's...
Yeah, no, thank you for explaining that, because I previously work with the chiropractic very closely, and osteopaths as well. I do spinal manipulation as well, so I kind of know the base what changes. But many times people have this worry because the chiropractors, when they come into the treatments, exactly is this back racking with spinal manipulation, and that's it. So they worry that they don't get much treatment from chiropractor that they get from the other therapists. Yes,
yeah, and I think that's traditionally chiropractic was a lot more focused on spinal manipulation, and that was it. And I know people have all heard stories of chiropractors treating that way, and it's but I think we have grown and evolved a lot, really. It's my treatments personally, I treat for half an hour with most of my patients. I've had patients who have said, "Oh, I've never had a treatment for this long before." So I know that other chiropractors do treat differently to how I do, but I think it's what I say to a lot of people is find the therapist that you get along with and find the therapist that you like the most. If that's a chiropractor, fantastic. I'm slightly biased that way because chiropractic can be fantastic. But as I said, the most important thing is that the patient is getting better and staying better, really.
No, that's a really good point. And exactly as you mentioned a couple of times, it's all about the practitioner, not the therapy which been used. Yeah. So even with the massage therapists, there's lots of massage therapists which they don't give as much care as the other ones, and many times I have the clients which had deep tissue massage which they've been completely bruised and in pain for the next week, and when they have the treatment with me, they just don't, and they like, how come it's different,
Exactly, and that's not down. And if you would never say, "Oh, don't see a massage therapist" after that, because that it would just be a one-off experience as well, and it's not all lumping everyone into the same basket, really.
And that's an important thing, because that's why I want to bring you on a podcast to give the idea and open up the conversation about what chiropractors do. And it's really amazing, great that you are one of those new therapists who actually open up and bringing and evolving your therapy to kind of show the care, and that the breaking the bad name of what chiropractic is, because that's why I done the spinal manipulation courses and everything, because I know and see the benefits from it, and I know it's really, really great. So can you explain us what it takes to become a chiropractor?
So to be a chiropractor, it's a 5-year full-time master's degree. There are a couple of courses across the UK. I went to the Anglo-European College of Chiropractic in Bournemouth, which is the oldest course in the UK. The other courses are at WEOC, or the Welsh Institute of Chiropractic, which is
Cardiff.
Glamorgan, so just near Cardiff, across that way, which is the same, another 5-year full-time masters. And a new course is starting this year, actually, as part of London South Bank University, in London South Bank down in London, which is really exciting to have a new course starting.
Brilliant. So, and what do you learn there? What it takes in there to, because you mentioned one of the part in the difference when you learning the imagining, which is reading the X-ray. What else were you spending this all 5 years?
So the first kind of 2 years is very heavily science based. You go back to doing a lot of chemistry, biology, anatomy, biochemistry. You start, and that leads to the basics of nutrition and bits like that. Do a lot of physiology, obviously understanding the body processes and bits like that. And then as you move forward through years, it gets a lot more clinical. So you start introducing diagnosis and more clinical management skills. And then each of those subjects is tested on throughout the whole course. As I said, there's a whole section of radiography, which is taking X-rays, and then radiology of the reading of X-rays as well. And then your final year, your 5th year, alongside lectures, you have a clinic placement. So at our clinic in London, there was I think at the time, or if not, it is the largest chiropractic clinic in Europe, if not the world. I know in our year we had 140, 130 chiropractors all working in this clinic, and you have to have, and you have to achieve, or you have to see a certain amount of patients and have to achieve a certain amount of treatments, which are observed and signed off by other members of staff. Once you've done that, you complete your final set of exams and you're ready to go, really.
So do you know all the nerves in the body? Can you name all the nerves?
Right, you're going to test me now, is it? Yes, I do. I'm sure I do. Yes, yeah.
Good. So how chiropractors in the treatments, can you explain how the usual treatment is like, how chiropractors help their clients?
So, the vast majority, 95% of my patients will come to see me because of pain. Occasionally it will be for another reason. People might want an MOT or a postural check or for post-surgery rehab or something, but generally it'll be for pain. So the most important issue is firstly finding out where the pain's coming from or the reason for the pain. That's the first priority. So treatment will largely depend on the condition. So obviously how we treat a headache will differ hugely from a slip disc. All sessions will start with a full medical history, where we'll sit down with the patient and chat through their issues, concerns, to kind of get to the bottom of what the issue is. And then a full examination, and that might be, as I said, an orthopedic, neurological examination. And then we'll sit down again with patients and chat over our findings and say, yes, so you've got X, Y, and Z. It could be a slip disc, or it could be a muscle strain or an ankle sprain. And then I'll outline for a patient how long it's going to take to get better, roughly, depending on their lifestyle and numerous factors, what their expectations are. And I think managing expectations is a big part of that. As we spoke about previously, if a patient's expecting to run the London Marathon on Sunday, compared to if they're 80-year-old, their expectations are going to be different. Yeah. So managing those expectations are important.
So you're spending a lot of quality time for assessment and research and an initial consultation to kind of actually have all the findings.
Very much so.
Yeah, to get them better.
Very much so. I mean, I'll roughly split it. When a patient first comes to see me, we allow 60 minutes or an hour for that first session. And I'll split up into about 15 minutes of chatting, 15 to 20 minutes of examination, we'll have a chat about it, and then the latter half of the session we'll start treatment. The treatment's usually a little bit shorter in that first session just to get them started, and depending on how long the examination's taken. But then we'll start treatment, and treatment will largely, as I said, consist of, depending on what the issues are, but joint manipulation, joint mobilization, soft tissue work, massage, stretching, or active release as well. And then the last half of the session will be made up of rehab exercises or homework, really, for the patient to take home and work on. Some people will do it, some people won't. And so you can need to tell the people who want to make the difference. Yeah, as I'm sure you know. Yeah.
So can you talk a little bit closer, because people, listeners will be really interesting. Can we talk about the manipulation itself?
Yeah.
Can you explain what's happening? Is it painful? How you explain clients, what is it? So, our listeners have a better idea.
Yeah. So I explain manipulation to my patients is it's like a stretch or a mobilization to a joint. So if you were to mobilize a joint, you take it as far as it wants to go, and then a manipulation just takes it slightly further. So you're just stretching that joint a little bit further than you can do yourself. Occasionally, often when you manipulate a joint, you get a pop or a click or a noise. That is simply a stretching to the joint capsule.
So what's the sound is?
The sound is when you create a space within a joint. So when you suddenly stretch out a joint, gas is released because you've suddenly increased the volume of that joint, and that gas is released from the fluid inside the joint, and that's what releases the noise. And I liken it to cracking your knuckles. It's exactly the same noise when someone cracks their knuckles or bends down to pick up something from the floor and their knees pop. The only reason it would be painful is if the joint or the area is really quite inflamed. My personal issue or my personal preference, if something is really painful, I won't force it. I won't manipulate someone if they're in a lot of pain, and you can, or if they're scared or apprehensive about it, because a lot of patients every day will come and say, "Oh, I don't want any manipulation," or some people say, "I only want to be manipulated." It's very different, depending on their patient, but it shouldn't be painful. It's not a painful thing to experience. As I said, unless it is severely inflamed or really, really injured.
So can you clear this up? Because so when we have a spine, you can't just adjust the spine. Spine is not to be adjusted, is it?
What do you mean by that? Sorry, in terms of
just because many people think that their back is out of place. So that's why you need to put things together. Yeah,
that's very old-fashioned thinking. All you are is stretching a joint. Any change or any position you put it in with a manipulation, it will go back to its original place once you've moved that. However, the effect of manipulation means that once you've stretched off that joint, the muscles can relax down a bit. You're inputting some really good feedback to the brain that this area is okay. It doesn't need to be stiff and tight, because all that muscle tension that the brain's telling it that it needs. If you do manipulation, it's telling those muscles just actually we're okay and we can calm down a bit, which is why the rehab and the exercises then following up are so important. Because any change you make within a treatment, you then go on and the patient needs to back up those changes with their exercises in order to maintain them and keep themselves better after that.
Yeah, as always, I always say to my clients, what we're doing today is like 20% of you getting better. The 80% is changing your life habits and so on and so on.
So true. Yeah, so true.
Why the joints get stuck? Why do we need to manipulate them?
Quite a lot of reasons. It can get stuck because of pain. So as a pain response, the body will cause muscles to lock up and tighten up. And then that means the joints themselves will get a bit stiffer and a bit tighter. That's what one of the reasons I often say to patients is that they're not out of place, they're stiff and tight, and that's because the muscles are holding them in that position. That's the biggest reason that I will manipulate a joint, really.
Oh, brilliant! Thank you. So, as I said, chiropractors and all practitioners many times exactly cooperate and work together, and massage therapists working alongside to chiropractors. And so can you explain how that can happen, how chiropractor and massage can collaborate and work together?
Yeah, so personally at my clinic we have two fantastic massage therapists who work at our clinic, and we often co-manage patients. I said, although I personally do a lot of soft tissue techniques, sometimes we feel that patients would really benefit from a really good focused muscular treatment from a really good massage therapist, and it's that co-management is really, really good between therapists who really know what they're doing. So we hired two really, really good ones, and they really, really help our patients.
No, brilliant. So massage therapy before seeing chiropractor or after? What's there?
I would say often, depending on the issue. I know there's no right or wrong. Some patients might be quite apprehensive about having any form of treatment or anyone touching them. So sometimes having a gentle massage to start with is really, really useful. It relaxes the patient a lot. And sometimes vice versa. Sometimes people need a bit of stretching or a bit of rehab or a bit of stuff like that first, and then work on the muscles afterwards once they've done it. So it's largely down to the patient. On the whole, I would say it doesn't really matter. Some people will benefit first, some people benefit afterwards. Most people in our clinic will see massage therapists after they've seen me, just because I will assess them first and then decide what's appropriate from there. But that's just the way it falls.
Brilliant. So what do you think about, there's a couple of courses around UK and so on, when the massage therapist on the higher level of education can learn the spinal manipulation? There's this weekend courses. What do you think about this? What's your input about this? That's, I am a massage therapist, but, I had done a course of spinal manipulation, which I am able to treat, to adjust clients. What do you think about this?
So it's obviously the most important thing is patient safety, and I think as long as people are able to assess contraindications to manipulation, because that's the biggest issue, learning when to manipulate, when to adjust, and when or when not to, more importantly. And I think as long as people are learning that and they can prove that they are safe with that, then I don't have a problem. And whether that's a physiotherapist or a massage therapist or anyone else that doesn't do any manipulation.
No, brilliant, because exactly that's what one of the things for you to learn on this course. It's not about, learning adjust manipulation is very easy. The techniques is very easy, it just comes with the practice as well. But the one important thing is why you're doing it. And, and as you mentioned already, it's not, it's not always that's what you do. Not always you do the manipulation. There's other things you can do just because, this is technique. It's just one of the techniques you have in your skills to help these clients better. Yeah.
Yes, well, one arrow in your quiver, if you will. Yes.
Exactly. So, many massage therapists would like to work in a chiropractic clinic. So, can you tell us what are the steps, or what you, as a chiropractic, as a business owner, what do you look in an MT massage therapist to hire them? So,
looking for MTs, I think someone that works well alongside me and understands the values that we have of the clinic, or that the value that our clinic has, is the most important. And someone that wants to work alongside us and with us in a similar fashion to how we work is, I think, the most important thing. Having individual practitioners work alongside you wanting to do their own thing, I don't think it will ever work. So my advice to people, if they're doing that, will be to really research the clinic which you want to apply to. And really tailor your cover letter or highlight parts of your CV to that effect. So rather, every week we get applications from MTs or from other therapists who are just blanket dropping CVs saying, I'm a massage therapist, can I work with you? And, if you're heavily involved in sports and rehab and want to work in that field, don't apply to a clinic that only does acupuncture and treats, only pregnancy or pediatrics. It's not going to work. So I think, research being really tailored and specific in your application is really, really beneficial. And I can say that the 2 or 3 that we've had are the people that we've hired. So it's really useful.
Yeah, definitely be curious, and even go and try the treatments over there.
Very much so.
Because that was exactly what's happened with me. I went to the clinic to get treated, and then and it was funny because the treatment was on one day, and then next day I had the interview.
So, oh, really?
So when it was just that was a really quick thought, let's go and try it. And that was just the one spot, and I was booked it. And the next day I show up for interview, and it's like, what are you doing here?
That's brilliant. Yeah, that's what you want.
Exactly. So any advice for people or massage therapists or anyone who would like to become a chiropractor and want to go this direction? So any advice for them?
I would say go and observe a chiropractor is going to be the biggest, to really understand what someone does. Because it's all very, very good listening to people like me speak about it, but until you've actually seen it yourself, it's very hard to appreciate. So I'd say really go and observe some chiropractors, observe many different chiropractors as well, and look at the websites, and really appreciate the differences between people. They might be subtle or they might be very large. So really get an appreciation for what we do. If anyone wants to come and observe me, they're more than welcome to. But yeah, so really observe. It's quite science-based, so going down the science route at school, or making sure you've got the right science qualifications to apply is also pretty essential. But I think that's it. Observe the other therapies as well, and see what if you can appreciate any differences or lack thereof differences, and make sure you're really committed, because a 5-year course is a long course, isn't it?
Oh yes, very big commitment.
It is, but it's great fun.
So thank you for answering this question. I think really our listeners really appreciate that. So the next question I have for you, because lots of our listeners are either just starting up, or maybe they just been in the business for a while, but they're still struggling to work on building their business. So next question I have for you: if you woke up tomorrow morning, you still possess all the experience and knowledge you currently have, but all your business and completely disappear, forcing you to start from the scratch, what would you do?
It's a hard question, that one. So I'd look at it in terms of what do we do well, and what the bits which that worked well for us when we first set up. I think correct research into the area you want to set up is vital, and really look for a gap in the market somewhere. There's no point setting up in an area that's completely saturated with massage therapists or whatever profession it may be. So really researching the areas where you want to set up, looking at your competitors, finding out what you can do differently, and really finding out the niche which you can offer to the people in that area. And then a really, really good business plan. So really, really good business plans to really foresee any issues that may arise before they arise, or any problems that may arise. So then you can preempt them, really. What else? Reading an awful lot. Reading a lot about marketing and advertising and bits like that, which unfortunately, whether you like it or not, you have to do if you run a clinic. When we started, we knew nothing about, we don't get any lectures on marketing or advertising at university. It's something which you have to learn, and lots of money is wasted by us and lots of other people by testing out various bits. So learning about that is vital, and too often people are stumped because they don't want to market, or they're not sure how to do it, and it's very difficult to get right. So learning about that is very important, I think.
Yeah, no, thank you very much. So the next part is all about the you. So here we have a moment to get promotion of our guests. The courses, book, practice, anything they like. So we will give you a little bit of the freestyle time. Here you go. Okay,
so my name is Robert Beaven. I'm a chiropractor. I run Dyer Street Chiropractic and Physiotherapy Clinic, which is in Cirencester in Gloucestershire. We're a relatively medium-sized practice. In our practice, we have 3 chiropractors, a physiotherapist, and a women's health specialist physiotherapist. We have 2 massage therapists and a podiatrist. And we love treating our local patients with a whole manner of injuries. I personally love treating sports injuries. That's my main area of interest, and really helping athletes to get better, stay better, get back on the pitch as quick as possible, really. And that's me. If anyone would like to know more about what I do, feel free to email me or contact me. If anyone wants to come and observe or learn more about chiropractic, same thing. Feel free to email me, contact us on Facebook, or send the clinic an email.
Brilliant. Thank you for sharing. So the next we have our game, the Tag the Guest game. So we're going to ask you, who do you admire and why? And can you help us get recommendation for upcoming interview with me here at BusyHive podcast?
Okay, I will I'll tag my close friend David Elliott, who is a chiropractor. He runs a chain of clinics, or 3 or 4 clinics over in Essex, called Advanced Chiropractic Clinics. He employs a lot of massage therapists as well, a lot of massage therapists as well. So he works very closely with massage therapists. I think he'll be a really, really interesting guest for you.
No, brilliant. Thank you. So David, we'll be in touch very, very soon. So Rob, thank you very much. It was a really great interview. I think we covered really great ideas to explain our listeners what a chiropractic is all about, so we have a better understand as a therapist in this. So if you had just one thing to take out of this episode, what would it be?
I think I'd want people to take home the importance of going back and analysing and assessing what you've done previously. And it's that there's an old adage, what's measurable is manageable. And it's so, so true. And you learn from your experience and going back and assessing what worked and didn't work. And that goes for patients, that goes for advertising, that goes for clinic systems and day-to-day management. It works with hiring and firing staff, everything. And I think, looking back and that hindsight is really, really valuable that you can take forward and help grow.
Thank you very much. So how can we connect with you online?
So you can look up our website. We are by searching Dyer Street Chiropractic on Google or putting in dyerstreetchiropractic.com. On Facebook, we are Dyer Street Chiropractic and Physiotherapy Clinic. And on Instagram and Twitter, we are Dyer Street Chiro, or at Dyer Street Chiro, I should say.
Exactly. Thank you. Really, thank you for sharing that. We're obviously going to put all the information down below in our short notes. Thank you for joining me here, and hopefully we're going to chat very, very soon.
Brilliant. Thank you very much, Chris.
Cheers. Bye-bye.
Take care. Bye-bye.